Hi, I'm Mark Friedman, Chairman of the Midsize Retirement and Healthcare Plan Management Conference. I have with me today Sharon Broadwater, who's one of our speakers from the Savage Companies. Sharon is speaking on cutting costs in healthcare plans. Sharon, one of the things that's on everybody's mind nowadays is the healthcare costs within their own company's plans. You've had a very effective strategy at Savage Companies. What are the main things you could recommend to other plan sponsors that might be able to help them control the costs?
Well, I think, Mark, one, knowing your people, but, a lot of plan sponsors don't really think about all the fixed costs behind the scenes. So one, you've got some fixed costs that you can start to manage with regards to premiums, administration fees, those types of things. So you really want to watch those, hone in on them. Again, educate your employees. At the end of the day, they're going to be the ones making those choices. But look at your pharmacy. Make sure that you've got effective co-insurance in place. Make sure that you're managing your generics. Make sure that your specialty pharmacy is aligned with the utilization that you want your plan to achieve. And then look at discounts. Look at all of your TPAs, ASOs, everybody who's you're doing business with. Make them resell themselves every single year. Make them hold themselves to a higher standard, and just really watch them.
Now, you talked about employee education. One of the challenges that we've always faced as plan sponsors is getting employees to understand their healthcare benefits. They're complex for us as plan sponsors, and we're professionals in this. How do we get employees to understand how their actions have an impact on what the overall premium levels will be, and how their own personal health might impact those overall premiums that they ultimately end up paying?
Well, I think that there's a conception out there in America. One, I don't think we're as engaged as we should be, and I think that people assume that as I get older, I'm going to have poor health, and that that's okay. And so it's that education of letting them know that they're responsible for that, and that they can actively go out, seek better care, that there is a difference in care, teach them that it's their money that they're actually spending. And I think that the more that you quit taking money out of their paychecks in the form of a premium and teach them to manage their money. I think that this has been the value of HSA and consumer-driven health plans. People have become more engaged in their health, and they understand that they can control it.
And we hear it time and time again, engagement is one of the keys to controlling these costs, letting people know how their actions really impact the overall costs of the plan, not just for themselves, but for their fellow employees. And one of the challenges that we all face is that the culture within each organization makes those challenges different. So what have you found within Savage Companies has been an effective thing to be able to get the people engaged?
We have gone out and just talk to our employees. We're very active. We encourage them to call us. We've developed relationships, and we have a relationship of trust with our employees. So we can change things on a dime. Our people listen to us, and they step back, and if we tell them to do something, they normally will do it because they now trust us. And so I think that the biggest thing that as an employer you can do is to talk to your employees and garner their trust. And I think at that point, you can start to move along this continuum of healthcare and wellness, and your people will march behind you.
All right, thanks, Sharon. That's a great point. That trust element is one of those things you work so hard to build with your employees, and it's so easy to lose. If you have to make tough decisions in your plan, if you're honest with your employees, it's that much more likely that you're going to be able to make those decisions and have your employees understand the reasons for them. They want to help as well, correct?
That's correct.
So, all right, thank you very much.
Thank
I
you.
appreciate it.
Thank you.